Hello and welcome to Alive with Amanda. We have talked about this before, but I'm going to expand on the topic a little bit in a different direction because so many people are talking about referrals being down. And then when I just do like my own little digging, I realized that maybe there are some opportunities for people in order to increase your referrals. And so I am very clear when I talk that we do a lot of our marketing through internet marketing. So Google, it's a big space that we utilize. And so other people may do community-based marketing, word of mouth, those kinds of things. And if that is what you're doing, that is great. That is okay. You don't have to do what we do, but there is an opportunity for you to go into the internet space in order to get referrals, especially if your referrals are down. If you come to me and say, hey, I've got plenty of referrals, no problem. I'm having these other issues with my practice. Let's clean that up. But if you're like, hey, I usually get word of mouth. It's been really low. What can I do? Internet marketing is a great way to go. And so one thing that I'll do is I'll look at people's website and then I'll look at the area that they live in and I'll cross-reference Google Keyword Planner. And so a lot of people will say, hey, my referrals are down. I'll look at their website. It's not optimized for keywords. It's not really clear what city they're in, what state they're in, and who they work with, right? And so those are three large components of SEO, internet marketing, is where you're at, so your location, because it's really location driven, and then who you work with, what your niche is, what the keywords are that you want to be able to have people find you. And then what I'll do is I'll cross-reference Google Keyword Planner. It's a tool right in the Google AdWords system, and see if people are searching for those things in your area. And so we really, really use this. We found in our area, people are looking for CBT, anxiety, depression, EMDR couples. Like that's what we advertise. That's what we do, but that's also what people are looking for. And so we make sure that our pages are optimized that say, anxiety treatment or anxiety therapy in Davie, right? Or CBT therapy, cognitive behavioral therapy in Davie. We really use those keywords, and it's so authentic because it's what we actually do. I'm trying to think of something that maybe is really popular on the internet that we don't do. I haven't really looked at the eating disorders in our area, but like maybe a lot of people search for eating disorders. We don't do eating disorders that much. Very, very, very little. We have like a couple of people who kind of like dabble in it, but it's not something that we do on a grand scheme. And so we don't advertise for that. So even if people were searching for it a lot, unless we really wanted to get an eating disorders program going, we would not advertise for eating disorders. And so it is very authentic to what we already do. So you want to take a look at what you already do and search. Because what I found is a lot of the times, and this is kind of like an old habit, is people will use the word marriage counseling because of a variety of different reasons. But really, we found the word couples therapy was much more searched. And we actually did this. We were doing weekend intensives. We were calling them marriage intensives or something like that. And when we switched it over to couples therapy weekends or something like, but we used the words couples therapy, the amount of inquiries we got like exponentially went up. And so you can go into Google Keyword Planner, you can put your location, and you can put a variety of words that you think people might be searching for, and it'll show you how much people are actually searching for. So you can see the terms that would be better for you to use. In most areas, it's always better to use psychologists. I don't recommend you use psychologists unless you're a psychologist, but if you have a psychologist on your team, having the word psychologist on your website helps you to rank better. More people look for the word psychologist. They maybe understand that better than they understand therapist or counselor, or it's just the more common word. And so you can play around with that and see what people are searching for, and then have your website match that, right? And start offering that. So you're actually meeting what the population needs. I'm going to talk about some things that we steer clear of when it comes to this. But first, I want to thank our sponsor, TherapyNotes. If you're looking for an electronic health record that's really full service that can help you build your practice and stay organized, I want you to check out TherapyNotes. You can do telehealth through there. They have a free telehealth option. You can set assessments to your clients, something that we really love doing. We're so happy that they have more and more assessments. You can bill insurance. You can take credit cards. They have a portal so you can send paperwork through there. And so it's really full service. It can be what your clinicians use or what you use really as the main point of contact with your clients and how to keep yourself organized clinically. And the best thing about them is their customer service. You can pick up the phone, you can give them a call, and they can help guide you through whatever it is you need. Or if you're new to TherapyNotes and you just need some help figuring out, what's left and right, they will help you. So I highly recommend you check out TherapyNotes. So going back to sort of the do's and don'ts, we have a lot of clinicians who will ask for specific trainings, for instance, and it's things that are great trainings. Don't get me wrong. I'm a very big fan of trainings, but it's not things that people are really searching for. So it'll help them clinically, but it won't necessarily help them get more clients or really work with the kinds of clients that we get. So we actually don't, I don't want to say we don't support those trainings, but what the trainings that we really do support is what people are looking for. EMDR, couples therapy, CBT, DBT, those are the four modalities that people are really calling for and they're calling about. They're not necessarily, maybe there's a one-off person that maybe is calling for IFS because they happen to see it, but that is not something that a lot of people are calling for. And so we're trying to build a robust practice, a clinically sound, robust group practice. And so we are matching the clients. If people started to call for that all the time because somebody did a really big special on it, then we might look at incorporating that into our training modalities that we have. And if people want to get trained in that, we certainly support them. We're excited about that. But really, the way that we run our group practice is we really want to meet the needs of our local population. And so if you're wondering how to do that, use Google Keyword Planner to find out what people are searching for so you can meet that, again, as long as it makes sense for your practice. I hope this was helpful. I'll see you soon, everybody. Bye.